Streptococcus pyogenes. It's beta hemolytic and it is in the group A if we see the Lancefield classification. And what is Lancefield classification? It is based on the antigenic differences in the C carbohydrate. So obviously the C carbohydrates are the important antigens which are present in the beta hemolytic streptococci. So the Streptococcus pyogenes is one of the most important streptococci, and all these streptococci, they are catalase negative. So it's not easy to memorize the Streptococcus pyogenes from an examination point of view. So we have designed a simple format. The Streptococcus pyogenes, first of all, you should know it has two important antigens. The one is C carbohydrate, the other one is M protein. It also has three enzymes. Most of the times it is asked in the exam to write on the names of all these important parts of the Streptococcus pyogenes. So these three enzymes, they are the hyaluronidase. The same hyaluronidase, we study a lot about it in the biochemistry classes. Then we have DNases, and then we have streptokinases. Then we have three important exotoxins. We'll talk about them after some time. Then we have two important hemolysins. These two hemolysins are very important. They are the streptolysin. They are the streptolysin O and streptolysin S. Then we have two antigens, three enzymes, three exotoxins, and three hemolysins. Now the importance of C carbohydrates, obviously it's in the classification and also in the identification. On the basis of M protein, various Streptococcus pyogenes, they are further divided into many types. Its significance we will discuss after a little time. Now coming right towards the exotoxins, first of all you should know the names of these exotoxins. These are erythrogenic toxin. Then the name of the second one is pyogenic exotoxin A, and then we have the exotoxin B. Their mechanisms of actions are very easy. The first two are super antigens. As the name is indicating, the super antigens are the ones which release more than normal amounts of the interleukin-1, and they bypass the usual processing mechanism of the antigens. So simply in the exam, it's more than enough to say that their mechanism is that they are super antigen. And the exotoxin B, it is simply a protease. Now what next to memorize? What diseases they cause? Erythrogenic toxin, it causes scarlet fever. And one of the important clinical feature of the scarlet fever is strawberry tongue. Then we have pyogenic exotoxin A, it causes toxic shock syndrome. Then we have exotoxin B, and exotoxin B, it causes necrotizing fasciitis. बेटे अभी नहीं खुल सकता दरवाजा. It causes necrotizing fasciitis. Now what are the importance of these hemolysins? We have two hemolysins, the streptolysin O and streptolysin S. The O is antigenic, S is not antigenic. What is the importance of this? That this is antigenic. Antibodies are formed against it which are called ASO antibodies. Now what are the various types of diseases which are caused by Streptococcus pyogenes? Three types of diseases are caused by it. Pyogenic diseases, diseases which are caused by exotoxins, we have already discussed. And then there are some immunologic diseases. Now these immunologic diseases, they are also called post streptococcal diseases, and they are one of the very important university questions. These are the two diseases. The one is called rheumatic fever, the other one is called post streptococcal glomerulonephritis. Rheumatic fever is type 2 hypersensitivity, while post streptococcal glomerulonephritis is type 3 hypersensitivity. Now read about all these things from the Levinson. What are the various pyogenic diseases? The Streptococcus pyogenes, the most important pyogenic disease caused by it is pharyngitis. Though some skin conditions which are caused by it, they are impetigo, erysipelas. The pictures of the impetigo, erysipelas you can see obviously from the Google and from your own textbook. The honey crusted lesions are very important. On the face of the patient there are certain lesions which are called honey crusted lesions. The cellulitis. Cellulitis is a very important clinical condition, and it is also caused by Streptococcus pyogenes. So the pyogenic diseases are pharyngitis, impetigo, erysipelas, cellulitis. And the exotoxin mediated diseases are scarlet fever caused by erythrogenic toxin, pyogenic exotoxin A, it causes toxic shock syndrome, and then we have exotoxin B, which causes a very severe skin disease, a very severe kind of a complication of the patients having the injuries on the limbs because of some accidents. If get infected by Streptococcus pyogenes, its exotoxin B can cause necrotizing fasciitis. Now the importance of these immunological diseases, what it means. The name is indicating post-streptococcal diseases. The patient will definitely have suffered from pharyngitis some weeks back. If the patient suffered from pharyngitis but did not get the proper treatment, can later on get the disease which is called rheumatic fever. What is the hallmark of rheumatic fever? Always remember till the final year, the hallmark of rheumatic fever is fever, arthritis and carditis. They are also called the Duckett-Jones criteria. There are also certain other important features, but for the third year level, we have fever, arthritis, carditis. The patient in the past suffered from pharyngitis, not of getting appropriate treatment. The patient later on suffered from the rheumatic fever, and the symptoms are fever, arthritis, carditis. And if anywhere in the exam they asked you what is the pathogenesis of rheumatic fever, if you simply write it is type 2 hypersensitivity, you will get the passing marks. What is type 2 hypersensitivity? We will read on during the lectures of immunity. Then post-streptococcal glomerulonephritis. It's a classical combination of hematuria, blood in the urine. Then there is hypertension. Then there is peri-orbital edema. It will be a child suffering from peri-orbital edema, hematuria and hypertension. These are the classical symptoms. Now, as the rheumatic fever can only follow the pharyngitis, the glomerulonephritis can follow both the skin conditions and pharyngitis. Mostly it follows the skin condition. These kind of impetigo, the child must have suffered from impetigo. There will be classical honey clustered lesions. The proper treatment was not given. So the patient can later on suffer from the post-streptococcal glomerulonephritis with all these classical symptoms. Now these two are very important. Their sign and symptoms are very important, which are usually there in this scenario. Now how these simple conditions they then later on change into all these things. The Streptococcus pyogenes is antigens, and the most important antigen here which plays role is the M protein. Now the M protein of the Streptococcus pyogenes, obviously the body will form antibodies against the M proteins. But in the rheumatic fever, what happens? There are certain parts in the human body which have somewhat same type of morphology just as the M protein. So body thinks when they form the antibodies that they are also the M proteins of the Streptococcus pyogenes. So the antibodies are also formed against those in the heart and in the joints of the patient. These are called the cross reactivity. So the type 2 hypersensitivity is because of the cross reactive antibodies. The type 3 glomerulonephritis is very simple. Here, against certain M proteins, which are the nephrogenic M proteins, the antibodies are formed and combined they form the complex. There is antigen and antibodies and together they form complex, and those complexes are deposited in the kidney and they cause the inflammation, and the result is acute glomerulonephritis. Rheumatic fever, type 2 hypersensitivity, acute glomerulonephritis, type 3 hypersensitivity. These two are post-streptococcal diseases, and we are talking about Streptococcus pyogenes. And Streptococcus pyogenes is beta hemolytic gram positive coccus, which is catalase negative. It is bacitracin sensitive. It is sensitive to an antibiotic which name is bacitracin. It grows on blood agar. There are some other certain serological tests, especially for the diagnosis of pharyngitis. From the throat swab taken from the patient, the antigen can be detected. Now here was one word, these ASO. The ASO titers means the levels of the antibodies of the ASO are a very important diagnostic criterion for the initial diagnosis of rheumatic fever. So this whole story is all about Streptococcus pyogenes. It has 2 antigens, 3 enzymes, 3 exotoxins, 2 hemolysins, and it has 3 types of diseases. Some are caused by exotoxins, some are pyogenic diseases, and some are the immunological diseases, rheumatic fever and post-streptococcal glomerulonephritis.